Hello and welcome to DrugsPlus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. In this video, I'm going to give a brief overview of the pathophysiology of peptic ulcers. Peptic ulcers are chronic, solitary lesions in either the stomach or the duodenum that become exposed to gastric juices. This condition presents nocturnal epigastric burning sensations as well as heartburn and bloating. 3 in 20 men will develop a peptic ulcer at some point in their lives, but only 1 in 20 women. As uncomfortable as the symptoms are, the main issue of peptic ulcers are the complications that they can cause, one of which is penetration. This is when the ulcer burrows into the pancreas or liver, exposing them to the gastric juices from the gastrointestinal tract, causing them significant damage. Another is perforation. This is when the ulcer opens into the peritoneal cavity, exposing the peritoneum to the contents of the GI tract, causing inflammation. And finally, upper GI bleeding. This is when the ulcer erodes into an artery, causing the patient to bleed into their GI tract. In these cases, there is a 10% mortality rate. Some of the most common causes of peptic ulcers include stress and smoking, though these are believed to be negligible. A more significant cause is the overuse of non-steroidal anti-inflammatory drugs, such as ibuprofen. The number one cause of peptic ulcers, however, is the bacteria, Helicobacter pylori. In gastric ulcers, H. pylori infect the gastric corpus, whereas in duodenal ulcers, H. pylori infect the gastric antrum. H. pylori is transmitted by food, water and saliva and is more prevalent in developing countries and poorer socioeconomic areas. This bacterium secretes urease, which it converts to ammonia and uses as protection against gastric juices. Its presence can be tested for by an antigen test from a stool sample. When H. pylori infects the patient, it first causes chronic gastritis. This increases the secretion of gastrin and pepsin, both of which damage the mucosa, causing the peptic ulcer to develop. This is a gastric pit, an invagination into the gastrointestinal epithelium. Here, parietal cells secrete hydrochloric acid via proton pumps. Additionally, chief cells secrete pepsinogen, which gets converted to pepsin by the hydrochloric acid. These acids digest food and are known as gastric juices. And finally, mucus cells secrete mucus and hydrogen carbonate ions. Not only do these form a protective mucus layer to protect the cells from gastric juices, but they also act to inactivate pepsin. So, mucus and hydrogen carbonate ions work in a delicate balance with hydrochloric acid and pepsin. If the latter predominates, then peptic ulcers may form. However, if the former predominates, then food will be left partially digested. So the key is to maintain a healthy balance. Also in the gastrointestinal epithelium are enterochromaffin-like cells. These secrete histamine, which go on to activate H2 receptors on parietal cells. Parasympathetic nerves also release acetylcholine, which go on to activate muscarinic 3 receptors, also on parietal cells. Additionally, gastrin from the blood activates CCKB receptors, also on parietal cells. Acetylcholine and gastrin also stimulate ECL cells to secrete more histamine. The activation of H2 receptors increase intracellular cyclic AMP concentration, while M3 and CCKB receptor activation increases intracellular calcium concentration. These all go on to enhance the release of hydrochloric acid from proton pumps in parietal cells. However, prostaglandin E2 acts on EP3 receptors on both mucus and parietal cells. This stimulates the release of mucus and hydrogen carbonate while inhibiting the release of hydrochloric acid. All of these processes are manipulated in pharmacological treatments for peptic ulcers, all of which I will discuss in my next video. Thank you for watching. If you found it useful, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. I'll be back with more pharmacology videos soon.